Doctor, why do I have varicose veins? And what can I do to avoid it? So this is a bit of a complicated question because we know after all these decades of studying varicose veins and why they happen in human beings, very uniquely I may add, is that this is a question that does not have a simple answer. We know for a fact that part of the tendency to get varicose veins is something you inherit. So if your parents have varicose veins, you're 4 times more likely to have varicose veins. But that is not the complete story. What also matters is how you have used your body, how you treat yourself. For example, if you're overweight, your chances of getting varicose veins is much higher. We know that pregnant ladies often have varicose veins, and that is the result of 2 factors. One is the weight of the entire baby and everything that's growing inside the mother, which presses down upon the veins in the abdomen and thus causes a reduced flow of blood from the legs. Also, the hormones which are increased during pregnancy have an effect on the valves in the veins and cause the veins to become large. And this is part of the process which makes delivery easier and things like that. So, there are now hereditary factors, genetic factors that you're born with. There are factors like pregnancy and growth which can affect the occurrence of varicose veins. There is the fact that if you're overweight and sedentary, which means most of the day you are standing in one position or sitting, then you have an increased chance of varicose veins. And that is something you can do something about. Losing weight, exercising, walking is a great exercise for preventing venous disease. These can all reduce your chances of getting varicose veins. He says, doctor, I have these few blue veins visible in my legs, and there are these veins which start bulging when I stand or exercise for too long. So is this like a big problem? Do I need an urgent therapy or something? So varicose veins are a very common condition. A lot of people have varicose veins. If you start looking at people over the age of 50 and start doing ultrasound in those people, you'll find almost half of them will have some kind or the other of varicose veins. Do they all need surgery? No, of course not. So when do we need treatment for varicose veins? Okay, first thing is you need to understand that varicose veins in themselves do not constitute a threat to life or limb. But of course, beyond a certain point, they can become symptomatic in a way that justifies the risk of therapy. So what is the point at which they should get treated? First thing is, if you are having symptoms because of varicose veins, then it's worthwhile considering treatment. What that treatment will be depends upon what's causing the varicose veins, right? As we spoke earlier. Now, if you have aching in the legs on prolonged standing, if you have swelling of the legs, if you have darkening of the skin of the legs, particularly around the ankles in the stocking or the gaiter area, then you probably need treatment for your varicose veins. If the situation is worse than that, then you definitely must get the cause of the varicose veins treated, and that requires you to undergo investigations, and then the treatment can be decided. What investigation is required? To begin with, we will nearly always ask for an ultrasound, which is a color Doppler, to see not that you have varicose veins, but what is causing them. We look at the veins of the leg, the big deep veins, and the superficial veins under the skin, and see which particular veins have the bad valves. And that is not the vein that you see enlarged under your skin. It is like when you see water leaking in a room. That doesn't mean the leak is where you see the water. The leak can be somewhere else in a bathroom 3 floors above, and you have to find that leak, because if you don't treat the right thing, you don't get a good result. So the first step is a color Doppler ultrasound to find out what is causing the varicose veins. Doctor, I've heard that this venous problem never really goes away, it can recur. And to some extent that is true. The tendency for the venous valves to go bad is something that is genetic. So this vein can go bad today and another vein can go bad tomorrow. So you can definitely have a failure of treatment or a recurrence, whatever you want to call it. However, usually treated by the modern means, the vein that we do treat, that usually doesn't fail. It is another vein which fails. And as we discussed, you have many ways to decrease your chances of having this failure of walls or this occurrence of varicose veins. As to repeat treatment, when a new vein fails, of course we can treat it similarly to how the original vein which had failed and caused the problem failed. So the treatment can definitely be repeated. The treatment happens under ultrasound most of the time, so it's completely free of radiation and major side effects. So repeating the treatment for, say, an accessory saphenous vein when we had earlier treated a great saphenous vein is always possible.